Methotrexate, MTX, is a cornerstone in the treatment of rheumatoid arthritis, RA, but its use in patients with lung involvement requires careful consideration due to potential risks and benefits. Key points. 1. Methotrexate-induced lung disease, MTX, pneumonitis. Methotrexate can cause interstitial lung disease, ILD, or pneumonitis, a rare but serious complication. Symptoms typically include cough, dyspnea, fever, and pulmonary infiltrates. It usually occurs within the first year of treatment. Risk factors for methotrexate-induced lung disease include older age, pre-existing lung conditions, and a history of smoking. 2. Pre-existing interstitial lung disease, ILD. Patients with RA often have lung involvement, such as interstitial lung disease, RA-ILD, which can complicate methotrexate use. The presence of RA-ILD requires a more cautious approach, as methotrexate could potentially exacerbate lung disease. However, the evidence is mixed. Some studies suggest that methotrexate does not necessarily worsen RA-ILD and can still be used cautiously under close monitoring. 3. Risk-benefit analysis. The decision to use methotrexate in RA patients with lung involvement should be individualized. For patients with mild or no significant lung disease, methotrexate may still be used with regular pulmonary monitoring, e.g., PFTs, chest imaging. In patients with severe lung involvement, alternative treatments may be considered, such as biologic agents, e.g., TNF inhibitors, rituximab, that do not carry the same risks for lung toxicity. 4. Monitoring. Baseline lung function tests, such as pulmonary function tests and high-resolution CT scans, are recommended before starting methotrexate. Regular follow-up with lung function assessments is essential, especially in patients with pre-existing lung disease. Any new or worsening respiratory symptoms should prompt immediate evaluation, and methotrexate should be discontinued if methotrexate-induced pneumonitis is suspected. Conclusion. Methotrexate can be used in RA patients with lung involvement, but careful consideration and monitoring are required. The presence of pre-existing ILD necessitates a more cautious approach, and in some cases, alternative therapies may be more appropriate. For a patient-specific recommendation, it is essential to consult with a rheumatologist and possibly a pulmonologist. The medical-legal aspects of methotrexate, MTX, use in patients with rheumatoid arthritis, RA, and lung involvement, particularly interstitial lung disease, ILD, are significant due to the potential for severe adverse effects and the need for careful patient management. Here are key considerations. 1. Informed consent. Documentation. It is crucial to thoroughly document informed consent when prescribing methotrexate, especially in patients with pre-existing lung disease. Patients must be informed about the potential risks, including methotrexate-induced lung toxicity and alternative treatment options. Risk communication. Physicians should clearly communicate the risks and benefits of methotrexate use, emphasizing the potential for lung complications and the importance of regular monitoring. This conversation should be documented in the patient's medical record. 2. Standard of care. Adherence to guidelines. Physicians are expected to follow established clinical guidelines for managing RA and monitoring for methotrexate toxicity. Deviating from standard protocols without justification could be seen as negligence if adverse outcomes occur. Baseline and ongoing monitoring. Baseline pulmonary function tests, PFTs, and high-resolution CT, HRCT, scans should be performed before initiating methotrexate in patients with lung involvement. Ongoing monitoring for lung toxicity is essential, and failure to do so could lead to legal liability if complications arise. 3. Management of complications. Prompt action. If a patient on methotrexate develops lung symptoms, e.g. cough, shortness of breath, immediate evaluation is necessary. Delay in diagnosing methotrexate-induced lung disease or failure to discontinue the drug in a timely manner can lead to severe outcomes and increase the risk of malpractice claims. Referral to specialists. When lung involvement is present, timely referral to a pulmonologist or collaboration with one is important. Failure to involve appropriate specialists when needed can be considered a breach of duty. 4. Patient selection. Careful patient selection. In patients with severe lung involvement or at high risk for methotrexate toxicity, using alternative therapies may be more appropriate. Prescribing methotrexate inappropriately in high-risk patients can be considered negligence if adverse effects occur. Documentation of decision-making. The decision-making process should be well documented, including the rationale for choosing methotrexate over other therapies. This includes consideration of the patient's overall health, lung involvement, and risk factors. 5. Handling adverse events, timely reporting and management. Adverse events related to methotrexate use must be promptly reported to regulatory bodies, and the patient should be appropriately managed. Failure to report or manage these events can have legal repercussions. Liability for methotrexate-induced pneumonitis. If a patient develops methotrexate-induced pneumonitis, and it is determined that the physician did not adequately inform the patient of the risks, perform necessary monitoring, or manage the complication appropriately, physician may face legal liability for malpractice. NAR 6. Legal precedents. Precedent cases. There have been cases where physicians were found liable for methotrexate-related complications due to inadequate monitoring, failure to discontinue the drug, or lack of informed consent. Physicians should be aware of these precedents and take preventive measures to avoid similar outcomes. Conclusion. The medical legal aspects of methotrexate use in RA patients with lung involvement emphasize the need for clear communication, informed consent, adherence to clinical guidelines, and diligent monitoring. Proper documentation and timely management of complications are essential to minimize the risk of legal liability. In complex cases involving a multidisciplinary team, rheumatologists, pulmonologists, and legal counsel if necessary can help ensure comprehensive care and legal protection.